Hi, I'm Dr. Selena Matthews, spiritual psychologist, and I want to welcome you all to Soul Transformation. My guest today is Dr. Guy Citrin. His practice is in Beverly Hills, Citrin Wellness. The topic today is ketamine and the treatment of mental illness. For sure, this is going to be a stimulating conversation, so please stay tuned. Dr. Citrin, so great to have you back on the show to talk about this really exciting topic, ketamine therapy. What is it?
Thank you so much for having me too. We had a great last talk. Today we're going to be talking about ketamine therapy, and I know that's been kind of a hot topic. A lot of people are probably curious on what ketamine does and is. There's probably a lot of people who are also scared and have also heard some negatives. So I think today we'll probably talk about all the components of ketamine. But ketamine ultimately is a anesthetic that at high dose is also an anti-pain medication. And in my opinion, incredible tool to help battle depression, anxiety, and PTSD, especially drug-resistant depression, anxiety, and PTSD.
Wow. Why is it helpful for those types of for those types of conditions like treatment resistant? That's really intense.
Yeah, and it's in the publications, don't take my word for it. If you just go, and we have this on the website too, if you want to look on our website, we have some.
And your website is citrinwellness.com.
.com. Yeah.
Perfect.
Citrinwellness.com. We have a ketamine page, and it explains a lot of the research that's kind of been coming out. I have to credit the MAPS organization a lot for their involvement. And there are a lot of international companies like Field Trip, Mind Bloom. There are some bigger companies that are doing ketamine therapy at home for patients, and they're publicizing their research, which is really cool. At our clinic, we've taken it kind of a step further in ketamine treatment. And ultimately, it's just, your question was, why does it work for depression, anxiety, and PTSD, especially drug resistant? And to explain that, I'd have to explain the mechanism of ketamine and how it works on the brain. So would you like me to go and talk about it?
Absolutely, because I have no idea.
Okay.
That's the truth.
So it's fascinating, right? Mental health is fascinating. And so we talked a little bit on the last talk that we did, but anxiety, and I'm just going to repeat kind of what I said last time, was anxiety has been taught to me as been fear of the future. Depression is fear of the past. And the reason I love that so much is because ultimately, if you understand what's called neurophysiology, you can understand the mechanism of these ailments, essentially. So what happens is, and they did this with, if you guys remember the old study with Pavlov's dog, right?
Yes.
So
Yes, of course.
Right. So it's like psychology 101, right?
Right.
It started functional MRIs, and it started PET scans in the brain and all this stuff, brain scans. And so what they found was, and I'm just going to repeat the study for those who don't know it, they rang a bell to the dog and they presented a treat, right? And they did this over and over and over again, and they studied the areas of the dog's brain that got lit up when they rang that bell. So what happens is, eventually they started ringing the bell, and the dog started salivating before you saw the treat. So that they saw that there is a neuro pathway that was generated auditory to the salivary glands, right? But without a treat, without anything in the mouth that would cause a salivary response, just by thinking. And you can, if you think about, this is very, very easy to explain to somebody if they think about a sour lemon. If you just picture a sour lemon in your mouth, you start salivating. So how does that mechanism happen, right? So why is it that the body responds to a thought? And that is the basis, in my opinion, of understanding mental disease, right? How are we programmed, essentially, and what programs are running in the background that cause us to elicit a physiological response? When I say physiological, I mean body response, like salivation, right? So you think about a sour lemon and you start salivating, right? So that is a neurophysiological event that is occurring. So if we extrapolate that and we break it down, we start to understand the way the body starts responding to thoughts. And when we understand that, we can understand dysfunction as well. And we can understand how certain perceptions elicit certain chemical responses. So let's take depression or anxiety, right? Because that's what we're talking about. Mm-hmm. So when we have thoughts that induce a depressive chemical, right? Like a very easy one to explain actually is probably, it's easier to probably explain anxiety. Glutamate is a neurotransmitter that's excitatory in the brain. Mm-hmm. When we have too much glutamate, our brain revs up. It's excitatory, right? So on certain levels, it's very healthy. When it becomes overblown, excuse me, I'm joking. When glutamate becomes overblown neurochemically, it can elicit too much cortisol or stress response, and we can literally start agitating. We start shaking. So let's extrapolate Pavlov's dog theory so that people can understand. Let's say that you were or let's say somebody was in a car accident, right? Somebody's in a car accident and they're looking right. In the event that another car, let's say, hit them from the left and they're looking right, when they look right, they elicit a response of fear and anxiety, because in the event that when they were hit by that car, that's the chemicals that were released. If the trauma is strong enough, every time that they look right, they start creating those neurochemicals that elicit. This is just from looking, right? Same thing as hearing, right? When we hear the bell, right? When Pablo hears the bell, he starts salivating. When we look, right? So any triggers in our environment that once caused that reaction can recreate those chemicals of disturbance.
Wow.
So this is very important to understand in trauma, right? So when we are in a traumatic state, when we induce trauma, things as small as veering to the right, looking to the right, or the auditory sound, right? Like a lot of people, I don't know if you've probably seen this. A lot of people, if you elicit a loud sound, they jump, right? They get right? It's not them doing that. It's some sort of programming in the brain that created that response. They get a jolt of glutamate or whatever that chemical is. Their neurology turns on fire and they jump. It's loud sounds, bangs, that kind of stuff, right? Somewhere along in their line of history, they elicited a trauma that resulted in a chemical response and a neurophysiological response and created a reaction. Mm-hmm. So if everybody can understand that, right? So we are born, we experience all sorts of traumas in our life. We walk through, we navigate life, we experience the world ultimately, which is many times an unsafe place. And we create neuro patterns of thoughts. And those can elicit, again, chemicals that can create feelings of anxiety and depression. So that's just the neurochemistry, right? We're just talking about neurochemistry, right? So now it gets even more interesting.
Okay.
So there is something called your default mode network. Okay. And this is where ketamine comes into play. So your default mode network is the subconscious patterns that you've created time and time and time again. It is the operating system. It is the background noise. It is your judgment center. It's how you create all of your decisions when you are not actively doing anything. It's how you drive without thinking about driving. It's how you just do stuff and it's how you walk, right? It takes us years to learn how to walk as humans because all of the muscles are super complicated. How do we walk as infants? Why does it take so long? Because it's a very complex mechanism. But once it's programmed in the brain, it's automatic, right? So we just know how to walk. You don't think about walking. You don't think about, I'm going to activate my tibialis anterior and lift my arch and move my pelvis and rotate and breathe at the same time, right? You're doing everything automatically. How does that happen? What part of your brain controls that? That's called the default mode network. When you study disease states and mental illness, you'll see that in trauma, people get programmed in their default mode network. So the same thing that I was talking about, when you turn to the right, you can elicit chemicals of depression and anxiety. Let's say if you were in a stressful event when that happened. However, if you're constantly perceiving the world as a threat, and this is my experience of anxiety and depression, when the world has become so scary that all of the things that have happened create the perpetual feelings of fear, anxiety, depression, you're consistently thinking along those patterns. And this goes into you know this more than anyone, Dr. Matthews, like Buddhist studies, right? Like if we really study spirituality, right? If we study meditation, if we study all these things, it probably the best way I think about it is perception is our reality. And if we perceive at a threat, if we perceive the world at a threat or a harmful place, our reality is then a harmful, difficult place. And it's because our thoughts create chemicals that perpetuate each other, and we're consistently thinking along those same patterns.
Right. Absolutely. 1000%.
So ketamine, and why I love it, is and this is why it's a very complicated conversation, ketamine shuts off the default mode network. It turns it off. Yeah. Turns off the default mode network. And that's why I love it as a therapy. Because when you turn off these perception centers, this automation that's running in the background, the best example is that, your operating system, the best way I can think about it is if your computer's super bogged down and it's not functioning fast, you unplug it, you reset the computer, and bam, everything's back online beautifully, right? So it happens all the time. Same thing for the brain. It's just a more advanced computer. So how do we turn off the operating system to give the brain a relaxation point? What is the point of meditation? What's the point of doing all this advanced spiritual work? A lot of it is to quiet the brain, right? You want to quiet the mind. In Buddhist thought, it's taught as the monkey mind, the perpetual mind that never stops. We want to shut down that brain. We want to shut down our perceptive centers. We want to shut our default mode network to just give it a break. That's what ketamine does. It gives the mind a break. And for people who are so anxious that every waking moment for them, they are caught in loops of perpetuated thought patterns that cause further dysfunction, they can't break out of those.
Do you think some of those are, from previous lifetimes? Some of those thought patterns, do you think they're from this lifetime? Do you think they can be genetically transmitted? They're in genes? What do you think?
I mean, you're going into Bruce Lipton's work.
I don't know Bruce Lipton. I'm just.
Oh, you don't know?
I have no idea.
Bruce Lipton studied epigenetics. Epigenetics is how our environment shapes our genes, and they have found that generationally we pass trauma down up to 7 generations, which is insane.
Yeah.
So if you experienced a massive trauma, you are passing that genetic sequence potentially for 7 further children, 7 generations down the line. So they found it in earthworms. They were able to do this in earthworms. They found that the genetic variants that they caused trauma. They elicited this chemical response. And then they did this crazy earthworm study, and they found that 7 generations of earthworms still had the genes that they didn't have. They turned on certain genes that they did not have until they induced that trauma from 7 generations prior. So,
wow, that's amazing. That is amazing.
I don't know about
and I also want you to
lives.
know that it takes 7 generations to create a schizophrenic. I don't know if you knew that. It takes 7 generations or 7 generations to create schizophrenia in a person.
That's
7 dysfunction.
That's a
You,
fact. You know that?
I remember this from going to school, decades ago. Yeah, 7 generations to create. You
What?
can create schizophrenia with dysfunction over multiple generations. Yeah,
Oh
and
my
I
God.
was taught So it's like the worms and schizophrenia. It's crazy. It's wild, right?
Yeah. Wow. That's fascinating. I didn't know that.
It's a fascinating world.
Yeah.
This whole thing
Yeah.
about, but I'm fascinated by your discussion about resetting the brain. That is incredible. I
Yeah.
never knew that it did this.
Yeah. So ketamine, what it does, so back to that, well, so to answer your question, I didn't know anything about past lives. I know, past generational, like parents, right? If we study the chemistry, we understand that trauma is passed from kid to kid,
Mhm.
right? So, in that regard, yes, 100%. A lot of times, potentially what people are working on is their parents' trauma or their grandparents' trauma, and that's just gotten passed. That mechanism of action has gotten passed generationally. So, and that's a whole host of other things to work on. However, when we just look at as simple as your perception of the world creates your reality. If I perceive the world as a threat, the world is a threat. If I'm always worried about the next thing, I'm living in worry, right? My reality is ultimately how I perceive the world. And when I can change my perception, I can change my reality, right? This is a lot of this is
Absolutely.
all the stuff that's coming out now with Joe Dispenza and Tony Robbins, right? Like this is not stuff that I'm creating. This is
No,
this is
right.
now what we understand about quantum fields, about neuropsychiatric disorders, about why psychedelics are emerging as an incredible tool now. And in my opinion, it's because if you understand, again, kind of the same with disease, if you understand the mechanism, you can change the outcome. And in this reality, with what we understand so far about the way brain chemistry works and our ability to perceive and evaluate threat and ultimately our programming as humans, if we can change that, we can change your chemistry. Once you change your chemistry, you can live it, so ultimately, if you reset your brain, and not in a way that's scary, but just in a way that's like, hey, I'm going to give it a break for a minute, like meditating for 40 minutes a day or, whatever, you can start to change your perceptions. And when you don't have to live in a place of fear and perpetual anxiety, that's, in my opinion, when joy comes in. So a lot of times joy is is the opposite of anxiety. If you're anxious, you can't be joyful because you're too worried, right? You're too worried about, in my opinion, the future, what's going to happen, my survival state, all this. How can you be joyful if you're in a place of fear?
Right.
So, right. And so that's why I love ketamine so much, is because ketamine will reset the default mode network and it will give your brain a break. And so what happens, and this is really important, this is a program that we've created for development of mental issues, is we help people reset their brain. They meet with my incredibly talented integration specialist.
Mhm.
She's a doctor who studies in trauma, and she helps people look at the patterns of their dysfunction, their mental patterns of dysfunction, and try to figure out what triggers those and helps you break the triggers that cause that reality for you. And so she meets with them after each ketamine session for 30 minutes to help them unravel the things that have kind of come up through their sessions, and also then gives them homework, somatic therapy homework to do every day for a week that helps them set new patterns. And it's all about creating new patterns if we want a new reality. If we want a joyful, more joyous, perceptive place, if we want to get out of the places that cause us to feel depressed, anxious, those ruminating thoughts, the cyclical patterns of thinking, we have to stop. In my opinion, we have to stop it from a brain perspective. And then we have to create new patterns. And ketamine allows you to basically pulls you out of the weeds, shuts off that operating system. And when you come back to it, you can start creating new neuronal patterns.
Well,
So that's where the research is showing. That's why it's been so incredible for especially drug-resistant depression and anxiety, is because, in my opinion, it's getting to the root cause of why there's dysfunction, and that is the perception of threat or trauma. And if you can alter your reality with that and start thinking differently, you can perceive the world differently.
okay, so someone comes in to see you at your clinic, Citrin Wellness, and they come in and say, I would like ketamine. What's the process that you take them through? I
Yeah.
mean, what do they, how does that work? Can you
Yeah.
explain it so that people
Thank you for
know?
asking that. Yeah. So what they do is they come in, they consult with me. I basically clear them for ketamine. I think it's appropriate for them. There's a lot of people who it may not be the appropriate therapy for, right? So I need to make sure that I feel like it's correct for them, and it's ultimately in their best interest to do the program. So they visit with me for a brief visit. We kind of review everything. We go over their medications, make sure there's no contraindications, that kind of stuff. Once they're cleared with me, they actually meet with my integrative cardiologist. We do an EKG. We scan their heart. We make sure, like, chemically they can handle ketamine. Ketamine almost causes zero side effects, which is the coolest part. There's like a couple percentage of people that it's bad for. Ultimately, like, it's one of the safest anesthetics used in the hospital all the time for anesthesia because of how safe it is. So it's been around since the 50s. It's been used in hospital settings forever for pain at low dose. And it's very safe. That's why I love it. It's incredibly safe. But we just like to be extra cautious at the clinic. We just do an EKG. We make sure that there's no issues. We make sure that they can handle it. They meet with my integrative cardiologist, get cleared by him. And then they meet with my integration coach and specialist, and she walks them through what they can experience during ketamine, what their goals are, where they, what their perceptions are. They come in for a session. We typically do lozenges and injections, and I do a series of injections of ketamine. The lozenge really gets their body to relax. The lozenge is more for the brain, or the injection, excuse me, I said that opposite. The lozenge is very good for their body. The injection is very good for their brain. So we inject every 10 to 20 minutes, small little injection, and we get them deeper and deeper and deeper into their experience. And at certain levels, it becomes hallucinogenic. It is not the point of ketamine to be in a hallucinogenic state. However, there are people who have found profound revelations in that state. Regardless, we go super gentle and we go based on how the patient feels. So I never throw people directly into like the most advanced ketamine, because I can feel like that could almost be traumatic. So we go really gentle, we inject slowly, we basically titrate them, and then we check on them every 15 to 20 minutes. And they're in their private room with headphones, listening to beautiful music. It's very soothing for the brain, with eye mask on, and they're kind of in a quiet, dark room, covered in blankets, really cozy. And we come in and we inject, and then we keep them in that state for about 2 hours. Then they have about 30 to 40 minutes to kind of get up, get out of that state. They go home, they relax. The next day they meet with my integration specialist. She will ask them how they did in their session, and then give them somatic exercises on how to retrain their triggers for that following week. And then they come in again for the next week, do the same thing the next week and the next week.
So how many weeks? How many weeks is it? 4 weeks. Wow.
4 weeks. And MAPS has discovered that true restoration can take 6 to 8 weeks. Mm-hmm. So at 4 weeks, we check in. And this is just based on protocols. And a lot of people are really good at 4 weeks. And they're like, I'm good. I got what I needed. Thank you. Amazing. And a lot of people are just getting to the climax of their awakening, of their resolution. So then we either do another 2 weeks or another 4 weeks. But I don't want to put people on a 2-month program or even a 6-week program if they can get the benefits in a 4-week. So we basically just evaluate as they kind of go through. We have found that a minimum of 4 weeks is what it takes to create resolution, with a maximum of 8 weeks. So it's been really powerful for my patients. I have to say, more than I thought.
Can you give me some examples, like some examples of how they felt initially, and like, specific kind of
Yeah.
case.
I mean,
Yeah.
I have pages of people writing me of profound revelations that they've had. But
Wow. Are those on your website?
no, I'm really bad at marketing, so we will post testimonials. I just have
Please
like,
post those testimonials because people will want to see them.
I
They
know
really will.
we're working on it. I have a lot of stuff we do at the clinics. I just have to get that dialed in. But yes, we are. Hopefully, by the time you see the website, we will have had more testimonials, and we're going to try to get video testimonials so you can see people's journeys through this, because it's been truly revolutionary for a lot of people. But some of the biggest testimonials are just like, I feel really content and happy and quiet. I hear
Wow.
that a lot, just like all of like that needless guilt and worry and shame and anxiety and all that stuff is kind of washed away. And I can live, in some of the biggest things I hear is I can perceive the triggers that used to cause me to feel certain ways. And I've created a different reality with those triggers. Those triggers don't create the same things that they used to create in me. Like a really easy one is like, a lot of what I hear is like a parent calling, right? Parent calling, there's a whole illicit of neurochemicals.
Oh yeah, believe me, I get it. I get it.
You know that about me.
Absolutely.
Anybody is,
Absolutely. Yeah.
right? So that's a big one that's been, is like death is a big, for some reason, I've had a lot of resolution with people with family members who have died, parents who have died, siblings that, even children. Like I've had a lot of crazy, like around death specifically for whatever reason, people walk out of ketamine feeling much more peaceful with the people who have passed in their life. In COVID, that's been a big deal, right? And just overall, just more peaceful. The whole point of it is just to create a different point to respond from.
So what you're doing is you and your trauma integrative trauma person are putting them on a different lane.
Yeah.
Or you're just the lane that they were on, which was not functional. The ketamine moves them to a different lane so that because of the reset, they don't have to play that pattern or go on the old lane. They can go on a new lane.
Yeah.
That's phenomenal.
Yeah.
I mean, that is phenomenal. I mean, I try to do that in my practice with talking. It doesn't always work, but I try.
You don't try. I've seen your success stories. That is not true. You do phenomenal work.
But ketamine just gives it, it's the reset part that sometimes when people have very intense psychological trauma, and sometimes the trauma is generational, honest to God, and,
100%.
so pathological.
Yeah.
And if people can't see their way out of that pathology, this is why I think that, things that are treatment resistant this would be so incredible for them, because it's the reset that you can't do necessarily in traditional depth psychology. It's harder to do that. Like it's harder to undo all those wires because they've been there for so long and they're intertwined. But having that break allows for the shift to occur, which is sometimes really hard to do psychologically with someone who's in a really difficult place.
So I think this is really important to touch on, and this is what I think a lot of centers are missing. Ketamine by itself doesn't do anything. It's very important to understand. Like psychedelics, like mushrooms or ayahuasca or boof, a lot of people are chasing psychedelics. The experience of those psychedelics can be very revolutionary. Mm-hmm. But if you do not change your mechanisms of thought patterns, you will fall directly back to where you were. And I see this all the time. I did this incredible sound ceremony. I did this incredible mushroom ceremony. I did an incredible ketamine ceremony, whatever sort of substance or out of body thing that caused them to find relief. If those wires they're so entrenched in the way that we think and the way we're brought up, and they're hardwired so much, as you were just mentioning. Yes, the reset is beautiful, but the work is just as necessary. And there are so many centers that are not helping people recreate new platforms, putting the wires back in an appropriate way. And the relief sometimes is so amazing that people are chasing that high or they're chasing that experience. But if they are not working actively on recreating patterns, ultimately, in my opinion, it's going to fail on some level.
Yeah, oh, it makes total sense because you can get it. You can shift to another lane, but it takes work to stay there. I
Exactly.
mean, it's
Exactly.
work. It's
That's
work. I don't
beautiful. It's
care
work.
which way you go. It's work to stay there, and
Yeah.
you have to have guides to work with in order for you to stay on the new lane. There's no way because the body recalibrates to the old patterns
Yeah.
unless you're constantly at working at them. It just
100%.
does.
Yep.
Yeah.
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 Because they're ultimately they're hardwired. So you can
Yeah.
soft unwire them, but if you are not actively reworking, and that's why I love ketamine. That's why I love the program that we built, is ultimately because it teaches people to create new patterns.
Yeah.
And if they're not working on it on a daily basis, and again, I don't know if that's 4 weeks, 6 weeks, 8 weeks, and then there's homework after that as well. So a lot of times they'll still work with my integration specialist, or they'll do EMDR, they'll do other therapies afterwards, after they've kind of done a hard reset to recreate healthy patterns. And like a diet, like going to the gym, right? I mean, people, they miss that sometimes in mental health, especially, for people who are sometimes speaking of spiritual transformation. I find they're missing if I want to get strong in the gym, I got to go to the gym every day, right?
No, absolutely. Absolutely.
It's the
You got to
same
work at it. You got
thing.
to
You
work
got to
at it.
work for anything you want in this life. You got to work for, right?
Yeah.
So if we want mental health, we also have to work for it. So ketamine is such a beautiful program, but if you're missing the integration piece of it, in my opinion, you're just going to create a temporary pause and go right back to where you were. And it's really the constant work that's so necessary in towards rehabilitating true brain patterns that are problematic ultimately.
Wow.
And the other part that I like about the program is because I do so much with gut health. What I've noticed gut is so important in mental health is we often do a 28-day detox with our ketamine program. And then
Really?
also I haven't been, and also I think that's why we're potentially a little bit more effective, is because that is so important to metabolize all the chemicals properly in the gut and the liver, that you have to flush it out properly so you can utilize and get into a better brain chemistry from a physiological perspective. So we've noticed a lot of, like, my patients who I'm doing all the gut stuff on, and then we put through the ketamine program, I'm finding like such incredible testimonials. But I also think it's in part to gut health, diet. It's just
And the
a segment.
detoxification. Yeah, I think the detoxification, I'm a real fan of that. I
Yeah,
believe in that completely. Because
yeah,
if you don't, it's like going into a car wash. You go in, clean it out, move on. It
right,
it makes a difference. I don't
right.
know. It's just the image
I
that
mean,
came to me.
you probably see this too, right? I mean, if you see somebody, let's just say like you saw like a middle-aged, I don't know, somebody middle-aged, overweight, right? Eats kind of poorly, doesn't sleep, right? I mean, how much more difficult is your work with them versus somebody who's on top of their diet?
The difference is phenomenal. It is phenomenal. Absolutely. I mean, I try to talk to everyone, and gluten free, sugar free, and all of that. I'm a real proponent for that. Some people listen, and some people try it for a week and say, no, this is not for me. But we keep on trying. I mean,
Right.
and our job as practitioners is we keep on, encouraging and trying for success. But I am super excited about this ketamine thing. I
Yeah.
think it's revolutionary. And just the last question,
Yeah.
do you think ketamine is the future for psychiatric or psychological health?
I don't know if it's the future. I think it's a component for sure. I think
Okay.
it's emerging now as a very I think we fell into like a massive opioid crisis, right? Everybody's familiar with that.
Yes.
Um, that was a bit of a lie, right? We were lied to and tricked as a culture for pharmaceutical gains, like
Mm-hmm.
many other things. However, that created an epidemic, ultimately out of capitalism, and we are paying for that. Um, and our mental health post COVID and post everything is probably the worst I've ever seen it. I
Mm-hmm.
probably you would agree on that, right?
Absolutely, 1000%.
We are in we are in an epidemic of health disorders,
Correct.
and it's a really that's why I started doing ketamine, because I'm not a psychiatrist or psychologist. I can't help people emotionally, mentally as much as probably I'd like to, but ketamine is such a beautiful tool I can utilize and
Yeah.
work with people like yourself who can help other, unravel those patterns and dysfunctions. But ultimately, it's a tool that's going to open the gateway to other tools. MDMA assisted psychotherapy is coming out. It is showing massive I mean, that's going to be the future. In
Wow.
in my opinion, MDMA, ketamine, potentially LSD, psilocybin, right? We've been lied to a lot. This is a totally separate conversation. We've been lied to significantly as a population about the
Absolutely.
benefits of these psychedelics. We've been created to fear them. We are now noticing the research is undeniable.
Mhm.
Ketamine, something is like 80% of people undergoing ketamine have massive improvement in their depressive scores and anxiety scores. So we have some of that research again on the website, but people feel free to do your own research. You will see the numbers are incredible for transformations. And ultimately, the reason is, in my opinion, is it breaks patterns that are so difficult to break. And then it is unraveling them in a way that's easier for the brain to move forward without living in trauma,
Wow.
ultimately.
Well, Dr. Citrin, thank you so much for your brilliance, for
Thank you,
your,
Jerry.
incredible intellect and ability to help all the people that you do. I am blessed to know you.
Thank you,
Thank you.
Jerry. Thank you so much.